My name is Adam Law. I'm a physician in clinical practice, and today I'm in Pennsylvania, in Washington County, at the offices of the Southwest Pennsylvania Environmental Health Project. And I'm here to interview Denise DeJohn, who is a family nurse practitioner. She was born and raised in this area and has been in nursing for 20 years. Half of her career has been in this county, and she's been a family nurse practitioner for the last 4 years. Since February of this year, she has been working in the public health area with patients and clients who have presented to this project with symptoms and complaints relating to unconventional shale gas extraction. First question, Denise. Please could you describe for me the purpose of the Southwest Pennsylvania Environmental Health Project and its history?
Well, first off, we started up and running at about January of this year when I came on board. Just prior to that, Raina Ripple, our project director, and some of the other members of the team had been organizing it just previously in 2011, in the fall of 2011, trying to get this on board. And then we opened up our services in January of this year. And we are a nonprofit environmental health project that's addressing the environmental needs from a public health perspective. We're not a clinic. Even though I am a clinician, we're not an actual medical clinic here, not the public health type clinics that you might find at your state or local government level. But we're here trying to address the client's needs from a public health perspective in terms of assessing the needs, providing education to clinicians and to anybody local, any of the clients that come in, as well as getting data together to try to see where we can take this down the road.
And why does this project exist right here in Washington County?
We're here in Washington County because there's a lot of health concerns related to the Marcellus shale drilling that they're having here in southwestern Pennsylvania, or in Pennsylvania. And
at the moment, Washington County is one of the so-called sweet spots.
Yes,
is that correct?
Absolutely, absolutely.
So you have some of the highest density of drilling in this state or adjacent states right here.
Yes, yes, yeah, we do here right in southwestern Pennsylvania.
So when you meet people, clients or patients who have presented to this project, having been affected by shale gas extraction, what are the common symptoms that you've been seeing?
I've been seeing a lot more dermal and respiratory myself. I am aware that there are some GI symptoms and some systemic. I had one gentleman that had more systemic issues going as far as his issues, but for myself it's been more dermal and respiratory, and it has a lot to do with depending on the exposure, where the people are in proximity to the potential exposure.
Can you speak to that a little bit?
I had spoke to one family that had all aspects of the drilling industry around their home, from the actual well sites to the impoundment ponds, to the truck traffic, to everything that you could think of related to the drilling process was around them in their home. To people that are just living next to compressor stations, to people that are maybe a mile away from a well site, and maybe their only connection to environmental exposure is post flare, what they call flaring, when they're flaring the wells, and they're getting residual fallout from the flaring. So it just depends on everyone's exposure pathways.
So you're seeing people present with dermatological problems and pulmonary problems largely. How do you in your own mind separate them, say, from just a common rash or respiratory infection? What is it that is speaking to you about this?
Sometimes it's the timeline.
Mm-hmm.
From exposure. What did they, when I'm taking the information, I'm doing this from an exposure, not just the stereotypical interview process that you would in a physician's office, like what's your problem, but I'm looking at their total, the whole picture as far as when were you exposed, how were you exposed, what's your previous medical history, what do you do for a living, do you do anything, hobbies at home that you might be exposed to things. I'm looking at timelines to see exactly, is it something more affiliated with an environmental exposure versus something I did at my job 20 years ago, that kind of questioning.
So there are particular questions that get at the root of an environmental health history as opposed to the usual history of a presenting complaint.
Absolutely.
And you're doing this in a systematic fashion,
yes.
Is that right?
Yes. I might start out asking them the basic questions about their home situation. Do you have pets? Do you live on a farm? Do you live in a suburban neighborhood? What's your job? What kind of job do you do? Are you exposed to anything at work, at your home? And then I might delve into a little bit more of their health history. What kind of previous, if any, health concerns have you had in the past? What kind of medications are you on? Do you smoke? Do you drink? Those kind of line of questioning.
And have you noticed, as people come in who have been exposed to possible pollution from this industry, that there are any particular barriers that they come with when they first talk to you?
Oh, absolutely. I come from having been born and raised here in southwestern Pennsylvania. There's a lot of small communities here that are very tight-knit, and they have trust issues with strangers or anybody coming in from the outside, as well as, unfortunately, these large corporations are coming into their area and causing them what they consider as potential harmful health issues, so they're having a lot of trust issues across the board. So they're not sure whether to trust me as a healthcare professional. Am I working, against them, for them? Am I really truly going to help them? So there's a lot of trust issues coming across the board when they come in.
So how do you engage people? And I'm thinking now of how other clinicians might look at this when people coming in and they have these symptoms. How do you engage them in such a way that they're prepared to discuss or open up to you their fears or concerns about an environmental exposure?
Well, I definitely try to make them feel like they're not crazy, like I really care about their particular bit of information, their particular situation, and I really try to sit and listen to what's going on. And then when I do ask them questions, I try not to make them feel as though I'm blaming them for their problems. I'm not trying to blame anyone at this point. I'm just trying to find out the information, and I do it in a very calm and conversational type manner. And if it requires a little bit of a sense of humor to get them to open up a little bit, then that's what I do. I kind of gauge the person and treat every individual who comes in on a case-by-case basis.
So the industry itself, by virtue of, if you're living close to it, has a lot of noise and light and disruption. Does that manifest itself in any psychological or emotional issues that patients present with? Absolutely.
I think every patient that comes in here I have to think about their mental health as well as their physical health. Quite a few of them might come in very relaxed and very calm and willing to just open up and tell me what they have going on. And some of them come in very angry, some of them very nervous. And, I have to start with that trust issue. And then we work in my line of questioning. Then I'm asking them a little bit more about what's going on at home, because as you know, and as most clinicians should be aware of, that the mental health, someone's mental health should be key in the process, because mental health, a positive mental health, is going to be better for their general healing process, where someone's negative mental health, stress, anxiety, can not only exacerbate their health problems, can even cause health problems, and might even make them go down the road, if it becomes too much for them, to do negative behaviors, not just alcohol or substance abuse, but unfortunately, if they become too overwhelmed, might make them lead towards thoughts of things like suicide and those negative behaviors, and so I have to look at everything.
So this fits into the framework of biopsychosocial medicine, is that right?
Absolutely, absolutely. I can't just come in and sometimes in traditional medicine, when you present to a physician's office or an emergency room or an urgent care, the assessment might be based strictly on that one complaint or your complaints, and not on the big picture. I need to take everything into account, and not just find out what their health history is or their environmental history, but take into account the mental health part to treat to do the holistic, which is partly why I think my background is key in this, is the fact that as a nurse, that's how we're trained. We're trained to look at the whole person, at the whole situation, the situation holistically.
But of course, we're very concerned with physical exposures here.
Absolutely.
How do you get to the questions of, say, pathways of exposure? Are there any particular ways that you ask questions that will help elicit the right sorts of responses?
In terms of
where they're living, or in terms of whether their predominant exposure is through the lungs or through ingestion? Is there?
It's just sometimes I have to ask them, specific questions. Are they aware of what parts of the industry are around them? And if they're not, sometimes I have to, once we're done with the interview process that I am with them, sometimes I even have to investigate a little bit more on my own to find out what types of, what level of the industry is around them, if any at all. I have spoke to some people that are worried about their health status, but are miles and miles away from any particular industry production at that point in time. However, it's coming. So they just want to know a little bit more information to protect themselves down the road. I have had a few that are not really sure about what industry is around them, and some are extremely detailed and can give me distances. I have a well pad that's 500 yards away from me versus one that's and I have this around me, an impoundment pond, I have a condensate tanks, I have the various aspects of the industry.
So have you actually followed this up with site visits to any of these affected individuals?
I have actually gone to an individual's home and been able to visually see for myself where these particular, where the industry production is at. Sometimes I have had to go after the fact. If a person says to me, I know there's a well pad over the hill, I know it's down the road somewhere, I'm not really sure where it's at. Sometimes my colleagues and I who are with me will then take and leave the client's home and then drive around looking for, so we know in our mind where is the mileage and I can sit down and gauge it on say like Google Earth or Google Maps then later to find out exactly how far the industry is from them.
So clearly, as part of evaluating clients or patients who are affected, there's sometimes it's necessary to do a physical examination. You've been talking about skin and lung exposures. Is there anything particular that you're looking at when you're evaluating somebody physically?
I do a basic health assessment, the vital signs, blood pressure, heart rates, pulses, that kind of thing. I listen to their lungs, especially if there is lung exposure. If they are, I haven't had as much GI symptoms myself come in or speak to me, but if they are having GI symptoms right when when they are talking to me, then I might palpate their abdomen and do a general physical assessment as anyone would in their offices or in their practice. Actually put hands on and do some tactile approach.
Okay, and presumably the dermatological manifestations of things that are there which you can evaluate, or are they usually historical?
A little bit of both. I have had a few that I have actually physically seen while they're here. Unfortunately, a good portion of them have been historic, because by the time that they get, either I see them in their home or they come into me, a lot of it has come and gone. And only in one instance did it come in, did someone who physically had dermal manifestations, was it in an area that the gentleman was a little uncomfortable showing me. So I had to go strictly on anecdotal. In that respect, but for the most part, it's even been in areas, arms, legs, chest, back, where I could actually visibly see them without much issue.
So once you've taken this systematic history and perhaps examined the patient, there are times when it may seem appropriate to order some investigations. Clearly, as a more of a public health approach here, you would be sending them back to their practitioners and providers. Are there any things that you're actually recommending to affected individuals that they should have screened?
That's a very good question. Unfortunately, it's a difficult task with the screening process and the testing process. I do have a lot of people call up here to the office or have come in and see me that want, I want lab testing, I want all the tests so I know exactly what I'm being exposed to. Unfortunately, that's not necessarily the way to go. Sometimes due to the half-life of some of the chemicals out there, the exposure pathways and the like, that by the time that they would be able to go to the labs or to the wherever it might be to get the testing done, it may show negative that they were exposed to anything at all, and that's not going to be very helpful. Most of the time I suggest that they go to their physicians or to their healthcare providers and start from square one, start the history and physical process, and that the healthcare provider would at least do the lab testing to go with the symptoms, because you're going to have the two different lab testing, that which is related to the exposure and that's which is related to the treatment, and that which is related to the exposure may never get done because we're not really sure what these people are being exposed to. So let's at least do the the chest X-ray, the general lab process to go towards the symptoms and that which we already know, and then we'll take it from there and start the weeding down process. When I look at the big picture and find out the history, then I'm going to slowly weed this out and find out what it is. It would be really nice if we knew exactly what they were exposed to, then we could take it from there, but unfortunately we're not even sure, even if we know what they're exposed to, if there's actually a lab test out there that that will even indicate whether someone's been exposed to. Unfortunately, there are some toxic substances out there where there's not even a test available for it. So it kind of is not cost effective nor good for the patient to do the blind, huge, all over toxicological type test and find out, and it will come back negative. Let's start from the ground up, and treat the patient from there.
So there is clearly, because we don't know what the toxicants exactly are, and also because there aren't any particular antidotes, there are no very specific recommendations based upon the actual substances they've been exposed to. But there are ways in which you recommend to clients or patients measures they can actually follow, for example, to monitor what's their potential exposure happens to be. Both, could you speak to that a little bit?
Absolutely, absolutely. Since we don't, like you said, since we don't know what these people are being exposed to, we're suggesting that if they can distance themselves from that which is they are being exposed to, that's not always a good scenario. Maybe they can't for whatever reason, to at least try to protect themselves from it, to take health diaries, to write down exactly, I'm feeling a certain symptom today. Well, look in your environment. Is the weather, what's the weather? Maybe the wind is coming from the direction of the potential exposure. Do you smell any odors? What exactly are your symptoms? And then if the weather is really good and a particular issue is I'm feeling better today, well then what changed today versus tomorrow, the next day? Did I take a shower that morning and then all of a sudden had ended up with a rash? Well, what was different in your day-to-day process? And keep the health diary, because a lot of times that will help us narrow down. Was this an environmental exposure or was this something else?
And are there any particular, for example, what proportion of your patients, because it's a rural area, are on wells or on municipal water supply?
I don't really know numbers, but I think it's about a 50-50. We do have some that you would in the area that you live in. Even I myself assumed that they would have been on well water, and here they do actually have municipal water in their area. So I think it's about a 50-50.
So is there anything that you recommend people to do if they're, say, on a well in terms of measuring anything in an ongoing fashion?
They should keep an eye on their water. If the industry has not come into their area yet, we would recommend that they make sure that their water's tested ahead of time so that they have the baseline numbers of the what's in the well or not. Even if you had your well tested when you bought your home 20 years ago, we would recommend retesting it again. Things could have changed, but you need a nice baseline so you know where you're at. Once the industry does come into your area, if you do see water changes or start having health problems that possibly might be related to water, then retesting then could be done to see if truly there were changes in your water related to any possible environmental exposure, or is it something else? And that would help your clinician know, well, is it water related, is it air related, is it soil, what exactly is going on, and that will help the clinician be able to treat the patient a little better.
And say testing the water for its pH or conductivity or other such methods, has that got a role?
Absolutely, absolutely. I have a colleague here who deals with that just a little bit more than myself. Her role is she's a little bit more educated in the actual details of the conductivity, but sometimes if there is some changes in your water due to any potential environmental exposure. You're going to have some changes in conductivity and total dissolved solids in your water. So if you have a nice negative number or low numbers before your exposure, and then we're testing it again and the numbers start rising, then we know that there's something going on there. So it's very inexpensive to test for the TDS, the total dissolved solids, and the conductivity initially, and then if we see the rises and changes in the numbers, then you can get the little higher level of water testing done.
So when you have somebody who clearly has been injured in one way or another, maybe has a more serious lung complication, what do you recommend? Because, as you say, the Southwest Pennsylvania Environmental Health Project is really more of a public health approach. What do you recommend in terms of a referral pathway?
If they have already seen their general practitioners, then I might recommend that they go see a pulmonologist, and we have a few in the area that are very, very good at what they do, and one in particular that I was aware of that has a little bit of an interest in what's going on environmentally in the community. If it's an occupational exposure, then I would recommend they see an occupational specialist, and we have a couple in the area that are involved in some of the educational institutions. So they have a lot of access to resources.
So we're always concerned about comorbidities, that people who have different conditions. Can you talk a little bit about how certain comorbid conditions could be exacerbated by exposures?
A lot of the environmental exposures and the toxins out there can exacerbate COPD. They can, they can change people's medication levels if they're on a particular medication. Some of the toxins can bind to the places that the medication is to bind to, which can then exacerbate someone's health status. Children with asthma, children themselves are already, pound for pound, they're going to breathe in, even if you and I were exposed to the same toxins that they are going to, they're going to breathe in double of that toxin just due to, body mass and lung size and developmental status. So, if they're already having trouble breathing because it's a bad air day in southwestern Pennsylvania with the toxins in the air, that's just going to really extremely aggravate their circumstances.
And do you find that's true at the other extreme of age as well? That absolutely. With an elderly person, their kidney and internal status, their brain functioning, all the way they metabolize things is already exacerbated in itself. The toxins, bringing the toxins in is only going to potentially worsen, might even, make them seem early stage dementia, might cause them metabolizing their medications, even greater than you or myself. What might seem like a standard illness, if they come into your office and you find out there's an environmental exposure, might truly just be due to excessive toxins in their bloodstream, affecting their mental status versus instead of being a kidney infection or a urinary tract infection. Here it might just be due to environmental toxins. That's why
I think it's important to look at the total picture, not just the symptoms and not just the presenting what they're presenting with.
One of the concerns that public health providers may have is the barriers that people have to presenting to their physicians. For example, economic barriers. This is often a rural area, it's underserved. Can you tell me a little bit from your own experience how that may affect patients in terms of seeking help?
Absolutely, absolutely. We do have a lot of underserved or patients who have absolutely no health insurance whatsoever here, economically deprived financially. Many of them will not go to a physician because of the cost of just a visit, let alone going to get testing done because they can't afford it. Some of them will occasionally, if it's an extreme emergency, use the a hospital's emergency department, but even then they're ultimately potentially going to get a bill. So many of them will not seek treatment and suffer quietly through most of their health problems. And unfortunately, that's where the catch-22 comes in. They need the treatment, they need to see someone. Occasionally I will try to refer them to some of the low-income clinics, or because some of the clinics, and we have a few in the area, that will at least see you based on your financial status. That's how they bill for their services, according to your financial status. But some of them still will not seek treatment just due to their the financial hardship, or maybe they can't even get to a particular situation because they do not have transportation because of financial need.
And in that situation, there's a role for visiting nurses or domiciliary services.
We try for that, but some of them don't. They don't. That's a stranger. They don't. They feel that I don't need that. I'll be fine. Some of them will try to care for themselves on a home basis with natural, treatments. Some of the people in the area will treat themselves according to the way Grandma taught. The different balms and concoctions that Grandma taught them years ago. I mean, they would rather do that than have someone come in, like a visiting nurse, and come into their home.
So one of your roles is in the area of education, is that right?
Absolutely.
And at least reaching out to the community to recognize, given that there is a high density of gas drilling in this area, to recognize that they may develop symptoms and what those should be in order to present. Could you speak to that a little bit?
It's just basically explaining to the individual a little bit about what's going on as far as the gas drilling process, how it might affect them, and then how it might affect them physically. If not now, down the road. If they're not already, if they're pretty healthy underlying, how it may affect their health and at what level. And as I already said, explaining a little bit about the gas drilling process. There are some clients that I speak to that are very, very knowledgeable about what's going on in their area, and then I just add to it health-wise. If they're already a smoker, of course I'm going to educate them on the perils of smoking, but then I'm going to add to it what the environmental exposure may add to that in addition. And enlighten them, and then give them a little bit more information about where they can go, even if they're savvy on the computer, what kind of websites they can go to educate themselves a little bit more, and resources in the area.
When somebody presents, they're presenting as an individual, but they're coming from a community, and that there are family members, neighbors who may be in the equally exposed. How do you approach the index case, as it were, in order to encourage them to spread the word of this around their local community?
Many times in the communities, they're already involved in their church groups, in their civic groups, whatever that may be, and I tell them to, if they're talking to their neighbor over the fence, by all means, tell them a little bit about us and what they learned, if they feel comfortable doing that. If not, do it in a generic type of way. We do have resources here at the office, some pamphlets, some sheets that I tell them that by all means they can take it with them if they choose to. Many churches have resource tables or resource places that I just place it in that area and allow the congregation to, or the members of that church to browse the information on their own. Some people like to talk to their neighbors in their community without problem, and some people like to keep it more low-key. But even if it means taking it to the town crier of the community and saying, here's this, and letting them spread the word, by all means.
So in finally wrapping up, you've now been involved in seeing people who have had these exposures from roughly the beginning of this year. Are there any particular lessons as a clinician that you've learned that you would like to share? Are there any particular pearls?
Absolutely. I believe I actually became better at my assessment process, and it's not just the physical assessment, but the investigative assessment related to the clients. And I have learned so much more on the toxicological end of the spectrum. I knew things like what carbon monoxide, coming from an emergency medicine background, what carbon monoxide might do to someone coming in, excuse me, and how to treat that. But I've been able to broaden my background and my knowledge base thanks to my involvement.
Thank you very much.
Thank you.